think we'll get started. So it looks like there's a lot of people who have joined a couple of these in the past, but for those of you who aren't familiar with the research communities, I'm Nola. I'm at Tufts University and I work on the A&H Academy team. Today we have Nishmeet who will be presenting some of his research, and I'm so glad to have all of you here today. I invite you to turn on your camera if you have enough bandwidth on your internet, and feel free to communicate during the presentation in the chat as you wish. So just to get started, for those of you who are new to the research community, some background. The research roundtable sessions give our community members a chance to share their research and have conversations about successes, failures, learnings, goals, and anyone can present. And we encourage you to use these sessions to share your findings or emerging research that's not yet complete. There are very few requirements to present. Pretty much, we just ask that you have a clear goal, offer a short description of your topic, and save half the presentation time to discuss with the rest of the participants. So past presenters have shared experiences in many countries all over the world, including Ghana, Nigeria, Pakistan, Uganda, and Vietnam. And presenters have also shared their work at the global level of analysis or regional level as well. If you'd like to present at an upcoming event, if you want to write a blog or share anything else, please email us at researchcommunities@tufts.edu, and I'll put that email in the chat in a second. And now I will pass it over to Nishmeet, who will give his presentation, and then after that we'll move open to the group conversation, and everyone can please participate as you wish. And if you've just joined, just another reminder, you can feel free to introduce yourself in the chat, and turn off your camera if you are able to. Turn on your camera, sorry, not off. Anyway, over to you, Nishmeet.
Thank you, Nola. Yeah, as Nola said, this is work that I've been doing at the University of Edinburgh as a PhD researcher. My name is Nishmeet, and work is based in Tanzania. It's titled The Drivers of Food Choice, and there is a specific focus on nutrient-dense fruits and vegetables in the context. And I'm thankful for the opportunity to sort of share. This is, again, preliminary work, so hoping to get some very useful insights as we submit the paper and go into the revision mode. So let me just move on. So I'll just give you a quick sort of background, then explain the broader research goals and the specific aims, and then what I'm going to talk today about, and going into the details of methods, findings, and then key takeaways or conclusion. So broadly, if you look at the science of food choice, you can summarize it in three questions or three sort of elements: what, how, and why. And then the what basically includes what do people eat, dietary intakes from the options available and accessible in their environment, measured through sort of dietary assessment surveys at the household or individual level and market-based surveys. Then the second block is how do people acquire this food that they're consuming? How do they prepare, distribute? And then it relates to some of the behaviors around not just purchasing, but also growing and gathering food, and how do they store it? And then how do they serve, distribute it within the family or to others in the community? And then finally, moving on to the underlying reasons of the decision-making process. So why do people make the food choices that they do? And it's all kind of interlinked into these three sort of dynamic elements. And so food choice is basically what I'm trying to say is not a static sort of model. It's a very dynamic thing where multiple elements play and come into being to sort of identify what shapes basically the diets of people. Moving on to the research context, I'm sure many of you are aware of the African context. The domestic supply of fruits and vegetables has increased in the last decade, but the consumption is not yet adequate. And when I say not yet adequate, I'm referring to the WHO recommendations where the fruits and vegetables per capita consumption of at least 400 grams or 5 servings of combined fruit and vegetables is the suggested norm. And so if you look at the specific context of Tanzania, you would see on the figure on the left Their diets are dominated by cereals, starchy roots, tubers, and green bananas. And then there is a lot of consumption of oils and fats as well. And then followed by animal source food, pulses, nuts. So what I'm trying to say is there is low consumption of fruit and vegetable, and simultaneously, independent studies have suggested that there is a rise in availability and purchases of processed foods. So diets may not be moving towards healthy compositions. Rather, it's moving towards unhealthy compositions. And then if you look at women in specific, you can see the only 39% women in urban areas meet the minimum dietary diversity, which is 5 or more food groups consumed, and only 17% of rural women meet this criteria. And then if you look at the factors that influence consumption and purchases, they're often in conflict, like I said. Uh, so affordability, preferences, demographic factors, and convenience are some of the factors that have been identified to shape women's food choices and food choices in general, but they sometimes are in conflict with each other. So what is not known, and this is like very tailored or very specific to what this research is based on. So what is not known is how, where, and when fruits and vegetables are purchased and consumed. And then related to that is like the element of food safety. So what are the perceptions and practices around food safety? Because fruits and vegetables are perishables, and there is a lot of contamination risks with associated. So how do people actually sort of perceive the safety, and what are the practices in the physical food environment that may influence consumption? And then why the food choices are made for fruits and vegetables. So we don't know much about how people interact with the physical food environments. What are the sources, like I said before? And then the other sort of factors are sociocultural influences or gender's perspective. And methods, in terms of methods, there is like lack of evidence on physical accessibility from remote settings. And in terms of research design, not many longitudinal studies or mixed method studies have been done. So specific research goal for this project is basically to characterize the driver's food choice for fruits and vegetables from a women's perspective in northern Tanzania, and addressing some of the gaps that I mentioned. Under aim 1, what we try to do is like we're trying to explain women's experiences of purchasing fruits and vegetables, including their buying patterns, perceptions, and physical accessibility. And then we have the other 2 aims where we look at food safety using a mixed methods approach, and aim 3, where we offer sort of more qualitative or ethnographic research methods. We use ethnographic research methods to offer more qualitative sort of insights into spatial elements of food environments, where we go beyond the physical food environment or the built food environment, as it's called, and look at sort of community food environment or wild food environments and those elements. So study context, the study overall is embedded within a larger project, which is the CGIAR Research Initiative on Fruits and Vegetables for Sustainable Healthy Diets, called the FRESH project. FRESH is an end-to-end evaluation, a longitudinal cluster randomized controlled trial run in 33 villages in 5 districts in the Arusha and Kilimanjaro regions. And the aim is to assess changes over time in vegetable production and fruit and vegetable consumption. And it includes over 2,600 households in the study. So research questions relevant for this presentation, as I said, it's under aim 1. What we're trying to understand is how do women living in northern Tanzania purchase fruits and vegetables in terms of their patterns, perceptions, and physical accessibility. And then we move on to related to sort of their diets. So what is the association between these factors and women's frequency and variety of fruit and vegetable intake? So those are the 2 research questions that we addressed in this presentation. In terms of data, so we are trying to use sort of combine the personal with the external food environment. So at the individual level, we have data around 2,600 women aged between 15 to 49 years living in the 33 study villages. We have designed a quantitative survey module on drivers of food choice, which includes elements of food safety, purchasing behavior, meal sharing within the family, and other factors. Then we have within that we have women's self-reported buying experience indicators, patterns, sources, frequency around availability. What do they think about, like, a source? What do they think about convenience? What are the transport that they're using, place of origin, and what's their motivation to consume fruits and vegetables? In terms of the intake data, we have a non-quantitative fruit and vegetable food frequency questionnaire that we are trying to use to measure dietary intake or intake of fruit and vegetable, actually. And in terms of the food environment, at the food environment level, we have data on around 1,260 independent retail outlets, as well as 15 markets that people use in these communities. And then from that, we're trying to sort of estimate measures of spatial accessibility to measures distance and time. In terms of that, we have, like, in terms of the analysis, we have 4 measures that we've defined. So buying frequency, daily, weekly, monthly, buying perceptions, availability throughout the year, market sources, convenience, and then we have the 2 accessibility measures, round trip journey distance and round trip journey time. And in terms of our outcomes, we have 2 outcomes, intake frequency score and the intake variety score. So yeah, and those have been sort of, we estimate the relationship between them using regression models. So in terms of measuring physical accessibility, and this is where I said, like, there is a gap in the literature in how it's been measured, because a lot of the studies have been based in the formal settings. So in terms of that, the gap that has been identified is basically, like, a lot of research uses the nearest outlet. But as you can see in this context, like, the markets are really far off. So this is a map from a sample context showing multiple fruit and vegetable sources in the food environment and the household clusters. And based on the surveys, we've kind of understood that it's not always the nearest outlet that people prefer. And so sometimes they do, and a lot of times actually they do travel far off. So you have to take into account, what I'm saying is, like, travel patterns, taste preferences, social norms about where people buy food. And so what we did was, we actually, like, within the survey, we asked them to report their typical sources that they use. And then instead of using the nearest sources, we used the distance, and we measured the distance and time to the reported sources, which we think is a more sort of accurate way. And then using the Google Maps API, we used what is called the road path network instead of the crowflies method, which is generally used to account for, like, the place of origin, the transport, and the typical paths that are available to people. So if you see in the map again here, like the brown that we see, like, the shape path, that's basically the path that, like, a woman would take to go to the market, rather than, like, the straight line path that generally people sort of estimate. So that's the difference. And you can see that it is a huge difference. If you do the straight line thing, it'll be like a 5 kilometer. But if you use the road path network, it's basically 8 kilometers and 100 minutes of walking. And again, like, when we were estimating this, we've sort of customized it based on their, like, the mode of transport that they would typically use. So if it was driving, you can sort of, using the Google Maps API, you can sort of customize to that level. So we think that this is a slightly more accurate way of estimating distance and time, rather than, like, just using the straight line methods, which is generally used. So moving on to the results. In terms of the demographic characteristics of the participants, or the women's age was, the mean of that was 38 years. 73% of them attended primary school, primary occupation. They were mostly self-employed in agriculture, 60% of them, and the household size was 6 members. So buying patterns for fruit and vegetables. So if you look at, and this was recorded for the 30 days preceding the surveys. So over 80% of basically women reported that they were buying fruits and vegetables in the market. So there is a lot of buying happening now. So apart from like, your own consumption or consuming from your own farms, there is a lot of women now who are buying fruits and vegetables. And then we asked who in the family was responsible. And as you see, women were mostly responsible for buying. So they are like the key decision makers in this sort of process. So so what drives fruits and vegetables? So this was asked using an open-ended free listing question, and the top drivers that women listed were appearance, taste. So when they are in the market, like, they look at the appearance and taste. Sometimes they taste it and smell it, and then they decide to buy. Freshness, and then of course income is a big chunk, big important factor there for fruits and vegetables. And then other factors listed were family preferences, food prices, and other stuff. So where they were buying, mostly, like I said, it's a mix, but fruits were basically bought from the market. As I showed, the market is slightly far off, and I show that later as well. But fruits were mostly bought from the market, whereas vegetables had more mixed sources. So mixed sources, by mixed sources, I mean more in-village sources, you can call them. So kiosk, directly from the farms, mobile vendors. So vegetables were like, spread across different sources, but fruits, those basically were bought from these market space. And so the frequency of buying, and you would see the difference, which is again tied to the sources. Basically, fruits were bought more weekly or monthly, and then vegetables were bought more daily, between daily and weekly. So the frequency of buying vegetables were more regular than fruit. In terms of perceived availability, we don't see much of a difference here between fruits and vegetables. People think it's available most of the time to them. So in terms of indicators of physical accessibility, for vegetables, most people were walking to their source. For fruits, 50% women were walking, but like for the other, they do use public transport. Place of origin was mostly from home, so which again sort of verifies our estimation when we calculate sort of physical accessibility. We did it from the household to the source. So this is just a quick verification that of the accuracy of our estimate. So if you look at the distance to fruit and vegetable sources, markets are far off, like I showed in the sample map. The median distance for fruits was around 9 kilometers that women had to cover. For vegetables, it was 3 kilometers. So you see the large difference between accessibility and across sources. Also, there was a lot of difference. The markets are really, like what I'm suggesting is they are far off. And then if you look at the time, fruits, of course, took 39 minutes. Vegetables, you don't see much of a difference here. And the reason being because, like I showed, it's tied to the source or to the mode of transport that they're using. I'll just go back and tell you. So in terms of the mode of transport, if you see, a lot of women do use motorbikes or public transport to commute to markets. That's why you don't see much of a difference in terms of the time. Yeah, and in terms of intake, you clearly see the difference, right? So 94% women, or almost everybody, like they're consuming vegetables regularly, and fruits are not being consumed that regularly. And then you can see the difference in terms of the food groups, the sub-food groups that they're consuming. In terms of the association, right? So moving on to the our regression results, what we find is like women who reported buying and weekly and monthly had a lower frequency of both fruit and vegetable than who bought daily. So we compare, our reference category is daily. So women who bought weekly and monthly had a lower frequency. So frequency is associated with buying is associated with lower frequency. And then women who perceived that vegetables of desired variety were sometimes or rarely available, so year-round availability was also found to be associated with the frequency of intake for both fruit and veg. And women who reported presence of a market in the village had a higher frequency of vegetable intake. We didn't see that for fruit because we know that now, like fruits are not available in the village or not available in their neighborhood. And compared to, if you compare the distance and time factors compared to the shorter distances, median distance had a positive association, but further distance had a negative association. So with the frequency of intake. So longer distances were negatively associated with frequency vegetable intake, and similar associations were found when you look at variety of intake. So women who again reported buying weekly and monthly consumed a lower variety compared to women who bought daily. Women who perceived that vegetables and fruits were sometimes available had a lower variety. Presence of market again had a positive association, in this case with the variety of fruit and vegetable intake. And time and perceived convenience were not found to be statistically significant with the variety of intake. So overall, what we find is a high proportion of women reported buying fruits and vegetables in the food environment. Buying frequency, perceived availability, and distance to the primary source were associated with both the frequency as well as the variety of reported fruits and vegetable intake. Our findings suggest that greater availability, especially in the vicinity, and improved accessibility to healthy food options may lead to better dietary quality. And further research, of course, is needed on women's experiences across the available diverse food sources, as well as how within the family or social living shapes some of these choices, and also around, like I said, food safety perceptions and practices and their role in food choices in this context. So I would end here and just want to thank to all the participants for their time and willingness, the funding, the funders, the PhD supervisory team that I have, and as well as the fresh end-to-end evaluation team. Um, and finally, leaving you to some of the, just to, if you're interested in the paper preprint, it's available. You can scan the QR code. If you're interested in reading more about the fresh evaluation, the QR code as well. And of course, I would love to connect with other folks and hear more about your research as well. So you can use my LinkedIn profile to connect with me as well. So thank you so much. Thank you for your time.
Thanks so much, Nishmeet. That was really great. It looks like we have a lot of people here joining and a lot of people as well from Tanzania. So especially if any of you would like to speak to your ongoing work or your lived experiences, please do. And yeah, I'll open up to conversation from everyone.
Nishmeet, if others don't want to start, I would begin just by asking, can you go back to the slide of the correlations
Sure.
showing sometimes a strong significance, sometimes a lack of significance, and just reflect a little bit more that one.
Sure.
And just reflect a little bit more on where you think the outcomes you see
Mm-hmm.
are driven by either something about the market itself and the supply questions
Mm-hmm.
versus the household's individual interests and demand. Sort of variation between households comes from differences in what they want to or can buy.
Mm-hmm.
And then differences on the supply side come from something that everyone has in common. So when
Yeah.
you're looking at correlations in cross section between households, the
Mm-hmm.
variation comes from differences between households. And
Mm-hmm.
then, but they're all perhaps shopping from the same places.
Mm-hmm.
By definition, there's less, there's a small number of suppliers and a large number of consumers. So just say a little bit about how these correlations
Mm-hmm.
are driven sometimes by supply and sometimes by demand.
Sure. Yeah. Thanks, Will. So if you look at it, right, I think what is happening is, and as I understand and reflect on your question as well, so in terms of demand, right, like the vegetable demand, and we've seen that in Tanzania over time, and I hope people who are natives can sort of explain that better as well. But what we've seen is vegetables have become a part of the main meal now. And what needs to be improved is more on like, the portion sizes, right? So that's where sort of, if you sort of improve the supply or make them available within the village or the near spaces, right? Like not the large port level market, maybe like, a few villages combined need a more sustained and regular sort of markets that are operating, and this will come out a lot more. So here what we've established is like, availability influences, but if you look deeper, availability within the village, right? Like I said, one of the important factors is presence of market in the village, right? That influences both consumption and frequency as well as variety of intake. So if you if you can strengthen that from a supply side, right, I think that will improve. And that is again tied to the accessibility element, right? Like where it's easier for women to buy if it's slightly closer to them than far off, right? So I think that's where the element, again, in terms of demand side, like you said, well, we don't find that, so if you look at perceived convenience, right, we don't find a significant impact of that. And I think that needs to be explored a lot more. And that's what we do later when in the other aims that we have actually. So we look at really what within the family or social living influences, what's the influence of culture, right? And what are the new foods that they're consuming as well, right? So what is in the background, like I was talking about, there is a lot of processed foods that's now available, frequently available in the neighborhood, more than fruit and vegetables. And I've seen that because I spent a lot of time in these communities. So from a demand side, the influence of preferences and joys and what's associated with social status and all of those elements, that unfortunately that doesn't come out here because this is just like setting the space in the first place, and then we later on move on to the other elements.
Thank you.
Nice.
I think we had a question in the chat from Masood, if you'd like to ask that. Otherwise, I can reiterate it if you're unable to unmute.
No, I can ask. Thank you very much. So thanks again. This was a brilliant presentation, actually. Very interesting. I was wondering few of the criteria you had in terms of the choice regarding the access to vegetables, right?
Mhm.
Women were talking about freshness of the vegetable,
Mhm.
taste of this thing, family, but there were like two other indicators which was not as highly rated there, but related to income and the food prices. I was wondering, did you explore any further how they are affecting, or like did you
Not
remove their effect
Yeah,
from
we
what?
did not do that. So in the model, we only controlled for household wealth. Of course, we didn't have the price data, and that's available from the food environment surveys that the Fresh team is doing. So we, of course, hope to, in another study, sort of adjust for prices. That data is collected, but in this study, we did not account for it. We only accounted for household and individual level covariates, women education, occupation, household size, wealth, and food insecurity. So those were the factors that we looked at, and we did not look at actually did not have exclusively price in these models.
Thank you.
Andrea, would you like to ask your question? And then we'll go over
Sure.
to Lupa, and we have one more in the chat. Two more in the chat now.
Great, thanks, and thanks so much for the presentation. I had a related question, and at the risk of sounding like a one-trick pony. I'm curious why you didn't include food price in this analysis. So if you can talk about that. And then relatedly, like I noticed that in one of the earlier slides, I think you were showing the women's perceptions of what drives their food choice. And I was actually quite surprised that food price was so lowly ranked in that order. So maybe that is perhaps why you didn't include it in this analysis. But I'm wondering if you have insights into why it's ranked so low compared to some of these other factors in this context? Because my assumptions are that cost is typically a major factor. And then also, and lastly, again, related to this, I'm wondering if you have any insights into what determines their buying frequency. Um, and I'm thinking again about costs, like is there perhaps is the buying frequency an issue of time availability or just the cost of transport or whatever that is? So yeah, I'll pause there. Thanks so much. Over.
Thank you, thank you. So yeah, in terms of, let me answer the last one first. So in terms of buying frequency, again, not a lot of work has been done. So that's where the qualitative work comes in, and where we are now finding that some of the factors that you said, the cost of transport, the physical sort of elements of accessing food, right? So like, how do sort of like, or is it easier to move around, right? And is it easier to reach some of these market sources that I said they are slightly far off? And if you look at, let me go back to that slide actually on the sample context, and you'll be able to understand. So if you look at this context, right, the map here that I'm showing, the market is really far off for this sort of the households that are here, right? So, and the average distance, like I said, is around 9 kilometers, and the paths are not really straightforward. So in terms of frequency, what influences is like, it's not, although like, the availability in the markets, the prices in the markets may be cheaper and there may be more food available, but women sort of trade off between like, cost and convenience, right? So, and based on my experience, I can tell you, this is again from the qualitative work that we've done, is basically like in a source, like you're spending, going to the market costs you around $3 to $4 US dollars, if I can put it in that term. And then like, within that, if fruit and vegetable is available in the sort of village or in the kiosk, and it's more frequently available, so the supply can be strengthened, you can buy a lot of fruit and vegetable from the kiosk. But kiosks generally don't operate that frequently, right? And so, and they don't have the desired variety that women want, and some of those elements. And in terms of prices, like I said, price data wasn't available at the time we were doing when we did the study. It is now available, but we did account for household wealth to sort of to control for some of the the affordability dimension. Yeah, I hope that answers your question.
Nilupa, if you'd like to ask yours, please feel free.
Sure. Thanks. This is very interesting. I wondered if you could just talk a little more about your experience using Google for measuring the walking path. I can imagine, and maybe I've got this wrong, but in certain settings, and it might be yours, where you have maybe more forest and so on, where people stick to paths. And just I'm trying to think of it in other contexts where we've been trying to do work where it's either in rural areas more open space where people don't have to, they might go a little cross country or on grass rather than on the pathway, or in urban areas where you might have alleyways. Like, how do you what's your experience with using this? Because it does seem like a significant improvement from just using kind of the Euclidean, straight line distance.
Sure. Yeah, thank you. I'm glad that you asked the question, because a lot of effort actually went into sort of looking at whether this was giving us the accurate sort of close, I won't say accurate, but a more precise measure of distance and time. And as you can see, the path that I've drawn actually in this context, and I've been to this context, so I understand, actually goes through the forest. And Google Maps API was able to draw that path for me. And it actually, I think it is now more advanced to give you sort of alternate paths as well. So if you want to calculate for a particular household or a household cluster that may be using different paths, right? And there are different ways to reach particular source. it is able to do that, but there are a lot of iterations that happen, and you need to, and it happens like, there are cases where sort of it won't give you like, any estimate. And I agree with you, it is difficult. And so that's where some of these assumptions you have to make and plug in, or like, with the straight line method. There is more detail in the preprint. If you see the paper, we've given details about what assumptions we've made. But from my experience, what I can say is in this context, it was, I think, for at least for the market sources, it was able to identify the sort of like the non sort of road paths that women were taking. And that's where we think that this is a slightly more accurate estimate of compared to the straight line. And as again, like I said, you can see in the map that the path that is drawn, I haven't drawn it, it's directly from Google API, and it goes through the forest. So.
I think we have a couple of questions in the chat. Let's see. Dagne, would you like to ask your question?
Yeah, I just wanted to know if the study also has taken into consideration those householders who might have their own vegetable garden and fruit trees compared to their, consumption pattern or buying habit. And at the same time, I wanted to know how seasonal variations can affect their demand and also their consumption pattern. Thanks.
Yeah, so this study is only cross-sectional, so we don't have like, seasonal data. So I can't speak much about that, at least for this study. But we know seasonality, of course, is a big sort of element in fruit and vegetable consumption. And that's where, again, like with the qual work that we're doing, we're trying to understand, again, from a women's perspective, how seasonality affects her choices, and not seasonality, not just in terms of the availability, but also the accessibility element, like, do paths or markets or the journey, or does that the journey change with seasonality? I think a previous participant also asked about, like, how do these paths look like? What's the convenience or what's the difficulty in accessing? And you would find, like, because they are unpaved roads and there is a lot of dust and dirt, a lot of participants do struggle to reach out to some of these far off sources. So seasonality is an element, like I said, not just in terms of the item availability, but also seasonality of the physical elements of the food environment as well. And then in terms of your first question, I don't think because this study was focused on women who were purchasing fruit and vegetables, so we did not include, and these are like 19 to 20% of women, we did not include, like, people who were not purchasing, and those again have been added to the qual work when we talk about, like, community or cultivated food environments and farming and farm, and there we get into more details about those households. Thank you.
Innocent, if you'd like to ask your question, and then we can go over to Alice after that.
Lola?
Yes, we can hear you.
Okay. Thank you, Nish, for the presentation. I've just shared one of my papers also did in Arusha on the local food market, and you have answered one of my questions on bringing in qualitative. I won't ask again about that because you said you are undertaking that. Could you take us back to the slide on travel?
Sure. Do you want to look at
Yeah,
the measure?
Yes, I wanted to understand more, a little bit more on the closest outlet where people buy veggies and
Yeah.
fruit.
Yeah.
It seems, unless if I misunderstood, it seems that many travel afar instead of buying at the closest outlet. Is that correct? Did I get it clearly?
Yes, yes. So if you look at, so there is a difference. If you look at here where they're buying, so fruits are mostly bought in periodic markets or permanent markets, whereas
Mhm.
veggies, they are of course bought in these markets, but also like, you know, if you look at mobile vendors, right? So a lot of veggies are bought from mobile vendors or even directly from farms. And this is where now that I remember, like, you know, the previous question about like, you know, how much of food that they're using from their own production can come in, right? Like, because neighborhoods, you have farms, like, you know, farmers directly selling vegetables. So fruit, like I said, is mostly bought from the markets, which are far off, but vegetables are bought from diverse sources, and some of these sources are actually available within the village, like kiosks directly from farms and mobile vendors.
Mm. That's okay. And you said the study was conducted in 5 districts in Kilimanjaro and Arusha.
Yes.
I was interested to understand where exactly you did the data collection. That's number one. Number two, did you also have to interview people at the market, or you interviewed people at the household going to the market, or vice versa?
Yeah, so this is only from the household surveys. There is a full sort of food environment survey that was done that includes different questions and different stuff. So you can, and I've just used the location of the, like, you know, the outlets, like I said, from here. If you can see in terms of the food environment level data, what I've used is just the geolocation for, like, you know, 1200 or odd outlets here to measure distance and time. But there is a lot of other food environment data that was collected, for which what I would direct you into your first question as well. You can sort of read more about the fresh evaluation. If you scan the QR code here or just type in fresh evaluation, you'll be able to read about, like, you know, at what level the data was available. So we do have household level as well as the food environment, the physical food environment data that's available.
Thanks.
Okay.
Innocent, I'm not sure if you're still here, but if you'd like to ask your question, otherwise I can ask it from the chat from before. Yeah, I'll just read out Innocent's question for everyone. In most food markets, fruits and vegetables are sold together at the same establishment. What was observed on this part, and how was it handled in analysis, for example, in calculating the distance to that selling point?
Yeah, so we calculated it differently because in this context, like I said before, and I showed in the figure as well, the vegetables were, like, you know, available from diverse sources. So there were no fruits actually. So we had to take into account, and that was taken into account when we calculated distance and time.
Great, thank you. Alice, if you would like to ask your question, and then we'll go back over to Masood from there.
Oh, thanks, Nola. So, Nishmeet, that was such a great presentation and insightful. I am curious to understand if in your study design, you accounted for possible variations in fruits and vegetable consumption during weekends. That is, if you accounted for it separately, because in the Tanzanian context, usually during the weekends, the household routines and what is usually eaten at the household level usually changes. So if whether or not you accounted that in your study design or in your analysis. And also, secondly, I would like to understand, while you're mapping the food outlets, did you also consider outlets that were closed at the time of data collection? Maybe did you revisit them in another day,
Uh-huh.
or did you exclude them in your study? And also the third question is, in the rural Tanzanian areas, usually internet access might be unreliable. So I'm interested to know how you manage these network connectivity challenges.
Okay.
Oh, thank you. Thank you so much.
Thank you for your questions. In terms of the weekend, controlling for the weekend, that is, of course, a limitation because what the intake data that we are using doesn't come from the 24-hour recall, right? So the intake data that we've used in this study comes from the non-quantitative food frequency questionnaire. So unfortunately, I can't really talk about the difference between weekend and weekday intake. It's a simplistic measure, as you would know, of dietary intake. But the Fresh team does have a paper that's now, I think, available in preprint about that uses the 24-hour dietary recall data that you can access and look at, actual, in a sense, more accurate dietary estimates from the study that are available. So this paper, unfortunately, cannot control for weekend and weekday consumption. In terms of food environment mapping, again, this was done by a separate team, but as I understand, it was very comprehensive. They did take into account closure of shops or independent retail outlets, and they did multiple visits. Again, I would direct you to the Fresh evaluation outputs that are available, and the food environment team has detailed sort of the method that they used and where the sort of some of the data gaps are. But what I can say from my experience, again, being in the context that I think the mapping has been fairly decent, and they've been able to cover a lot of retail outlets, remote retail outlets as well. Thank you.
Looks like we have a few more from Masood in the chat.
Thanks again. Yeah, so this is me as a nutritionist thinking how I'm going to apply some of the learning from here into our programming. So yeah, this question might be a little bit outside of the scope of your research, but I was just interested. Did you try and explore whether there was any sort of fruits and vegetables that were available, but not necessarily consumed always, basically under-consumed, right? And if so, what sort of factors might explain that? Was it like taste, cooking knowledge? Of course, price you didn't explore yet, but price or cultural preferences. So that's question one. And question two would be, did you explore, or do you have any plan to explore in the future the links between women's workload, time poverty, sort of like their mobility restrictions with their dietary diversity? I know dietary diversity is not something you try to explore, but we could say, and even the purchasing preferences could be a proxy indicator for dietary diversity in this case, at least.
Sure. No, thank you for the questions. And like I said, before, the qualitative work in this sort of the quant space, we were only able to ask, because there was a lot of unknowns here, we only asked, what drives food choices. And so what comes out is, again, I'll just go back to the slide, is women listing appearance, taste, smell. So there is a lot of the sensory attributes of fruit and vegetables that are important, along with freshness, household income, family preferences. So some of this, again, building on this work, we are sort of the ethnographic research that I've done in the communities will bring out some of these elements, like I said before, of culture, taste, preferences. And so, and what we are finding is, again, I alluded to this before as well, there are elements of difficulties in accessing some of these sources. So the physical element of the food environment, I'll reiterate, is important. then culture, of course, is important. And a lot of women, from my experience, are now aware that they need to consume fruit and vegetable. And I would separate fruit and vegetable here, because fruits are not available, like from this research, at least we know they're not available closer to where the households are. So maybe there needs to be work done to bring fruits closer and strengthen the supply chains, and that makes it probably more cheaper as well, or more affordable for the households. For vegetables, there needs to be a different strategy to increase more portion size, right? So like I said, the diets are more starch-based, cereal-based. So for vegetables, what I would suggest is there needs to be, they have the knowledge, right? It's just that they need to now be trained in, or there needs to be some work done to help them sort of guide towards increasing more portion sizes. And then in terms of convenience, like I said, it's convenient to buy vegetables, because again, they're available closer to women, and fruits are not. I hope that helps.
Thank you very much.
No worries.
We have just about 8 minutes left, so I'm going to jump to Nathan to make sure that we get a few more people involved here, but it looks like we still have a ton of questions in the chat. So if we don't make it to everyone, I encourage you to just connect offline and try to get each other's contact if you can here. I know that Nishmeet has already shared his LinkedIn as well. So, but yes, in the meantime, Nathan, would you like to ask your question?
Okay, thank you very much for the opportunity. And again, I'm Nathan Gesa from Uganda. My question was basically on two aspects. One is regarding the validity of your questionnaire, of your food questionnaire, in regards to the local context of Tanzania, whether that was done, but also the other is in terms of the GIS measurements, whether later on they were validated with the ground truth distances, or those from the local observations.
Yes. So in terms of the validity of the instrument, we of course, this was we've designed, but this is again based on partnerships with local Tanzanian researchers, and specifically the Sokoine University of Tanzania. And there was a lot of sort of piloting that was done before to sort of test the instrument. And now, this was, of course, the study, the data was collected between 2023 and 2024, but now we know that there is a food environment toolbox from a group, again at Rutgers, probably Shauna Downs and her group, which uses the similar questions, and that instrument is validated, I think, in 2 contexts, in India and somewhere else in Africa as well. I can't remember it, but the questions, what I'm saying is we did validate it locally. And then now we have a questionnaire that's validated in other contexts which uses similar questions. And then in terms of validation of the geospatial measures, like I said, I myself have been doing ethnographic work in these communities. So I can validate some of, based on that work, I can validate some of the measures. And I feel it's slightly more, that what I would like to say is it's slightly more accurate than what previously people have used. And that's where I said, we're not using the nearest source, we're using the reported source, which makes it, and taking into account the transport, the place of origin, and alternatives that Google sort of gives you to arrive at a slightly more accurate measure of physical accessibility in distance and time.
Thank you for that. It looks like we do have some more time left. So it looks like Faraha had asked if you could share the locations of the studies, and then Andrea, if you'd like to ask your questions as well.
Sure.
Yeah,
Thanks. Oh, sorry. Go
sorry.
ahead.
Just I was just saying the study locations, you could scan the fresh evaluation thing and you'll be able to do it. It's 33 villages, in 5 wards in Arusha and Kilimanjaro region. For the 5 wards, I don't remember the names. Sorry, but you can scan those and get that information.
Just 2 quick follow-up methods data collection questions. So, one, were respondents able to select multiple sources for their fruit and so like was the question like where did you mostly purchase fruit and veg, where like that would be a select one, or was it like were all the places that you purchase, which would be a a multi-select? And then also, do you have this data at individual food item level? Like, do you have information about like carrots and bananas, or when you were asking the question, were you asking it in terms of food group, like where do you purchase your fruits and where do you purchase your vegetables? Thanks so much.
Yeah. So on the second one, it's easier. We were not asking at the item level, so the questions are aggregated at the food group level. So they were asked separately for fruits and vegetables, but not like, specific to the items. On the first one, we actually had 3 questions to understand, like, the multiple sources that that women were using or the households were using. So we asked women, like, which is her primary source where she most frequently buys fruit and vegetables separately. And then we asked for a secondary source, and then there was a multiple choice question. I know there is sort of like, people do buy from multiple sources and you're not confined to one source, but we have information on all of these 3 sources, like, multiple sources that women use. But the distance and time measures have been calculated only for the primary source because that was reported as the most frequent source. Thank you.
Thank you very much, Nishmeet, and thank you everyone else who's joined us today and participated so much. It's been really wonderful. You should get a pop-up when you X out of this browser that will ask just a couple of short questions. So if you have a second, please feel free to fill those out. That's a tongue twister. And I will just put in the chat really quickly the link to the event page, which will have the recording of this event and also the links that Nishmeet has shared with us today. And please always get in touch at researchcommunities@tufts.edu. Thanks.
Thank you.